Malaria is the leading disease in Chad. It affects 22.6% of the population, and 19% of that 22.6% dies from malaria. Less than 3% of children sleep under the recommended treated nets for preventing malaria. 12% of pregnant women receive preventive medicine, and that's a 12%. That's a very small amount. Malaria is most found in southeast Chad, which is this area right here, if you look at it, where more vegetation and moisture is found, which would attract the mosquitoes carrying this disease. Payago and ExxonMobil Foundation, they work together to develop and update national guidelines and policies on malaria prevention and treatment. They share new skills and information on malaria with health providers. That includes doctors, high and middle level nurses, midwives, and laboratory and hygiene technicians working in the district and regional facilities. They expect these healthcare workers to share this information with community health volunteers who are critical resources in the community as they try to stress the importance for women to seek out parental care and other health services to protect their families and themselves from malaria and to try and keep this from spreading. And if we go to the Global Fund project, we will see that they have donated 3,600,000 nets, and these are treated nets with pretty much how we have here bug repellents. It's a mosquito repellent net for keeping whoever uses them safe, hopefully from catching malaria. You can see here grants going towards malaria. There are 2, and it shows that 83 million US dollars, which is 51% of their funds for diseases in Chad, goes toward malaria prevention and treatment, which is a pretty good number, especially considering it is the leading disease in Chad. And if you go to Chad, we have the other leading diseases would be the STDs, AIDS, and HIV. The statistics for AIDS and HIV aren't completely accurate or up to date just because the inability to keep accurate records and statistics, or their inability to gather accurate statistics. But in 2007, there's 18,000 known cases of women living with HIV, and the majority of children receive HIV or AIDS from their mothers, and there's 19,000 known children who lived with HIV. The Prevention of Mother-to-Child Transmission, PMTCT, program offers free HIV testing and drug treatments, but only a small portion of women actually have been tested for HIV. The Global Fund, which is this organization who does a lot of work in Chad, suspended over 20 million US dollars of funds to Chad for over 5 years because they had concerns over the misuse of their funds and the inability of Chad to manage the money, which really put back the development of combating HIV and AIDS in Chad, unfortunately. So Chad faces these problems because of a weakened government and the corrupt and the instability within their nation. And I think it would be really important for Chad to have a more honest and integrity in their government. within themselves as a nation, especially when so many funds is being poured in. If you look here, how much they have approved in U.S. dollars is 161 million, which is a lot of money going towards Chad. And they have actually HIV and AIDS has 4 grants, which you can see is more than other diseases that are prevalent in Chad. So it's something that really is on the minds of a lot of people to combat. And then another disease that they have other diseases, of course. Another one that is highly funded is tuberculosis. Although you can see in this graph that it's not as much of a concern as HIV and malaria.